Acute epistaxis. By definition, epistaxis is a hemorrhage or bleeding that's coming from the nose, the nasal cavity, and or the nasopharynx. Depends on this location, this epistaxis, or also what's known as nosebleed, could be anterior or posterior. The anterior nosebleed, as you see here, it comes from the nose or from the nasal cavity, and the blood, if the patient is sitting up, will be dripping anteriorly or outside of the nose. The posterior one is when the bleed is back in the nasopharynx, and then so the blood will be dripping back toward the throat. So it is important to, when we do the physical examination, to differentiate whether if it's anterior or posterior, because the management will depend on that. As far as etiology, when you understand the pathophysiology here, the nasal cavity, there is inside the nasal cavity a mucosa, and mucosa is covered by epithelial tissue. Anything that can irritate or lead to erosion in this mucosa and expose the blood vessels inside the nasal cavity can lead to the bleeding. The etiology, the common etiology could be trauma, insertion of foreign bodies, chronic use of topical corticosteroids, or abuse of nasal spray that used for decongestion. These agents can irritate the mucosa and leads to bleeding. Some other agents as the street drugs like cocaine. These agents, it's very irritating again to the mucosa and submucosa, and as well as anatomic malformation, whether it's in the bone structure or mucosa structure or even in the blood vessel structure, the malformation. Allergic rhinitis, presence of a tumor, all these conditions can irritate mucosa and lead to bleeding. Another thing could be if the patient has a coagulation problem, whether because of using anticoagulant agents such as aspirin or Coumadin, or because the patient has some bone marrow suppression. This happens for patient after they receive chemotherapy. One of the complications for chemotherapy is the suppression of bone marrow. Suppression of bone marrow will lead to decrease the production of platelets, which is very important for the coagulation. So this patient can also be at risk for nosebleed or epistaxis. So these etiologies, when you receive this patient and you collect the medical history from this patient, some of these etiologies, or one at least, will be reported by this patient. That's how we learn about them. The symptom that these patient will present with or lead them to seek medical attention is the nosebleed, and that's what you want to old cart. Now, as you know, as I said, we have anterior and posterior epistaxis. So after you collect the history, in the physical examination, we want to know whether it's anterior, which most commonly it's anterior, or if it's posterior, and simply by visualizing the nasal cavity by using a nasal speculum, we'll be able to identify the source of the bleeding. The medical management of epistaxis is geared toward control the bleeding. So this can be achieved by first aid measures, such as applying direct pressure on the lower portion of the nose. And if that doesn't help, then we can use other techniques, such as packing the nasal cavity with gauze. And if that doesn't work, we could also use vasoactive agents such as epinephrine. Laterally, again, we can apply that on a cotton. And you know that epinephrine is a vasoconstrictive agent, so that vasoconstriction will decrease the blood supply to the area where the bleeding is happening, and that can decrease the bleeding. Cutterings is another techniques that we can also use, as well as nasal tampon, which basically it's inserted. It has like a balloon that I can apply pressure and the area that where the bleeding is going on, and also we give it with lidocaine because it's painful. In a minute I will show you a video about the different medical management for epistaxis. It's very important that you do apply the first aid measurement. As far as nursing management, it's very important that you apply the first aid measures. As far as nursing management, it's very important that you apply the first aid measures. And this includes the first thing that you want to do after you're stabilizing your patient, reassure them, make sure that they are in sitting position so they don't aspirate, especially in the case of posterior nosebleed. And the most important and most effective thing that you want to do is applying direct pressure. And this pressure, you pinch the entire soft lower portion, as you see in the picture, for 10 to 15 minutes. Of course, the patient meanwhile will be mouth breather. If the direct pressure doesn't help, we can gently insert a small gauze pad to pack the area, again just to apply pressure. And if that doesn't help, then you can assist in the medical management that will have more of advanced techniques that we need to do. Now, when we talked about etiology, always we want to think of a prevention. So after we identify those who are at risk, we want to educate them about measures to prevent or to minimize the risk. Now, before and after. Now, these patients who are at high risk for epistaxis, you want to educate them to avoid the vigorous nose blowing, because that can increase the intranasal pressure. So basically, we want to ask the patient or educate the patient to avoid any activity that can increase the intranasal pressure, because that can increase the pressure, can increase the irritation, and can lead to the bleed to restart. These activities are encouraged to stop them for 4 to 6 weeks. Now, ask the patient again not to blow their nose. They need to have light activities, no lifting, no straining. So if this patient has a history of constipation, for example, an anti-constipation agent could be ordered. If they had to sneeze, we encourage them to open their mouth during the sneezing, because that will decrease the pressure as well, the pressure inside the nose. And if the patient has a coagulation problem, we need to consider stopping this medication or avoiding them if possible. Any medication like aspirin or NSAID or Coumadin, if the patient doesn't have to take them, then it's better for them to stop taking these agents.